Sadly, there isn't anything terribly exciting at the moment, which is, something that needs to be fixed. So one of the major challenges of clinicians at this point is that there really isn't a lot to offer to brain tumor patients. Now, I have to be clear, I'm mainly speaking about glioblastoma and other forms of glioma rather than secondary brain tumors. But in the case of primary brain tumors, there's two obstacles with having more clinical trials and generating more excitement around those potential trials. One is that we still see things like brain disease as an exclusion criteria on many of these trials. And what we need to do is we need to convince pharma that that it's okay to include those patients. That clinicians do have the expertise to manage toxicities specific to those types of patients. That if the scientific rationale exists, that it does make sense to include those patients. You'll see this still broadly across clinical trial portfolios in various countries. And so we need to really evolve in terms of allowing brain tumor patients to join these trials. And the other one is to really create better preclinical models to understand not just the biology of the disease, but how these drugs actually interact with the tumor, and learn to make good decisions in terms of when is a good time, when have we generated enough information from the preclinical work to move it into a phase 1 trial. And one of the things that we've had experience with is when we've worked with either licensed drugs or drugs that are far along in the drug development pipeline, such that there's already extensive safety data to warrant, for example, a phase 1 trial in brain tumors. But again, it's just this idea that because brain tumors are difficult to treat, that we still are reluctant to include them in any sort of trials, and that is the major hurdle that needs to be overcome, so that clinicians will have more to offer to these patients.